December 2nd, 2014. Roll call, please, Mr. Clerk.
Chairman Belanger.
Here.
Council Mercia.
Here.
Council Rourke. Here. That's three present.
Thank you. Three present. Along with the subcommittee, we're also joined by Chief Bill Taylor's here this evening, here to join us. Representative Tom Golden, who's been on the front lines in this issue for some time. Thank you, Representative Golden. Former Mayor, former City Councilor Bud Caulfield's on hand. Thank you very much, Councilor. We also have Kerry Detremont of the Greater Lowell Health Alliance, working tirelessly on this issue, serving not only Lowell but the region. Thank you for being here, Kerry. Frank Singleton, the Health Commissioner, is on hand this evening. So with that being said, this is the newly reestablished subcommittee that's been inactive for some time, but we're all in this room aware of the seriousness of this opiate issue, that and the ill effects that it has on the gateway cities such as Lowell. But it's, as we all know, not just a city issue. It's city, it's town, it's rich, it's poor, and it affects everyone of every demographic. It's an issue that certainly has no boundaries, to say the least. And it seems to be growing among a younger population, and with a discussion with Chief Taylor yesterday, it's alarming, the figures that are coming out with this opiate issue that's arising with 8th graders and above. And the statistics that the Chief's going to soon to elaborate on is going to be very alarming as to the amount of crime here in the city that is related to opiate issue and marijuana and other drugs that relate to the crime here in the city of Lowell. So with that being said, Chief Taylor, I'd like to start off with you, if you don't mind.
Thank you, Councilor. First of all, let me say, without question, drug abuse and drug trafficking in the city of Lowell account for a substantial amount of the crime that we see on a regular basis in the city. Most recently, there was a very unfortunate incident where a young lady lost her life over a relatively small amount of marijuana. And that situation is, still ongoing in the criminal justice system. But I think it received serious attention in the media, as it should have, and it was a very tragic incident. Sadly, that's not the only incident of its kind that we have investigated and had to deal with over the past several months. Increasingly, we see that drug distribution and drug use in the community is really at the core of a substantial amount of the criminal activity. Recently, the DEA high-intensity drug trafficking, it's an intelligence unit within DEA. They estimate that most robberies, thefts, shootings, and murders in this area, which is the metropolitan Boston area, have a direct connection, a nexus to the illegal distribution or use of controlled substances. So you can see that it's a growing problem. They also estimate that for every individual that's apprehended and charged with a criminal offense, that individual is responsible for at a minimum of 200 additional crimes that they didn't get charged with. And we've seen that just recently. There was a gentleman that was apprehended and charged with breaking into a motor vehicle. And when my detectives interviewed him to try and get a scope of his drug use, and in that particular case it was opiate use, and the extent of his criminal activity, he was very candid, and he was able to go back about 100 car breaks that he had done in the city over several weeks, and then he admitted he lost count. He couldn't really account for all of them. And that's really not, unfortunately, the exception, and it goes very much in line with the intelligence that the DEA is indicating. What I can tell you, too, is not only is it a cost in terms of its property crime and crime against persons, it also has a significant cost in the city with respect to overdoses. So far this year, we've responded already to date in excess of 260 overdoses in the city of Lowell. Not all of them fatal. Many of them, they have been revived with the use of Narcan, which is used by both the emergency medical services in the city and the fire department. Last year, we had 278 overdoses. So even extrapolating forward the current estimate, we will exceed the 2013 numbers of 278 for this year. I think that's a reasonable expectation. On a positive note, what I can tell you is that recently the Lowell Police and Fire Departments received a grant that my Research and Development Unit in the Police Department put forward to the state, and we will be receiving both training and both Narcan for both the police and fire departments. So I think that's a very positive development, and we'll put them out as soon as we can. The fire department already has some in their apparatus. This training and the supplying of the Narcan will allow us to put them in all the police vehicles, and then also replace the ones in the fire department as they get used. So I think that's a positive development, and it's much needed. Clearly, as I indicated, it's an ever-growing problem. Most recently, in the city of Lowell, we observed that there was a connection between gang activity and drugs in the city. It's unmistakable, and it's something that we felt as though we had to deal with. We put a significant contingent of detectives into a combined drug and gang unit. The results have been very positive. They've made several very substantial apprehensions in the past several weeks, and I expect that type of production will continue as we move forward. But that's necessitated because, quite candidly, the criminal element in the city has figured out that, and it's not just Lowell, obviously, it goes certainly across the Commonwealth and across the country, but there's quite a bit of money to be made in the illegal drug distribution, and it's incumbent upon the police department to fight it at every street corner and every opportunity we get. And I think that the results of the drug unit and the gang unit so far are going in a positive direction.
Thank you very much, Chief. Some alarming statistics nonetheless. Before I move on, next speak to the subcommittee members, would like to elaborate a little? No, Council? No? Okay. Second, I'd like to go to Kerry Detremont, the Executive Director of the Greater Lowell Health Alliance, that's working tirelessly on this issue in Lowell and Greater Lowell. And Kerry, you may have the floor. Please tell us what your organization is doing to combat this issue.
Thank you very much. I'm very grateful to be here tonight, and thank you for inviting me to speak about the work that we're doing through the Greater Lowell Health Alliance. And I just want to thank the City Council as well for taking the time to make this initiative in the city. I'm a resident of Lowell myself, so it's a truly an epidemic, so thank you. I thought it would be helpful if I taught mostly about what the Alliance is and what we do and the task force that fall under us, so that you can see that the work that's going on, not only in the city of Lowell, but also in Greater Lowell is our focus. So the Greater Lowell Health Alliance is a nonprofit organization. It's the whole name is the Greater Lowell Health Alliance of the Community Network Area 10. It's a nonprofit comprised of healthcare workers, business leaders, educators, and community leaders, all with the common goal around helping Greater Lowell community identify its needs and address those needs around health and wellness. The GLHA plays a critical role in helping individuals and organizations work collaboratively. So we're a coalition, and we work collaboratively to improve the health of the Greater Lowell region. We do this by raising awareness and providing resources for our communities, schools, and healthcare providers, and civic and business leaders. So the Alliance basically empowers them to make decisions and take actions that will lead to improvement in the overall health of our communities. So to achieve these goals, the GLHA has formed 5 health-focused task forces, one of those being substance use and prevention, which we had the pleasure of having City Council member Corey Belanger attend one of our meetings earlier this morning. Each of those task forces targets an individual healthcare need in our community. The task force members meet regularly to identify and evaluate opportunities where healthcare services are currently not being provided. So the Substance Use and Prevention Task Force, or we call it SUP Task Force of the GLHA, has been working diligently on substance use and prevention since 2008. The SUP Task Force works to strengthen collaboration in the Greater Lowell community and prevent and reduce substance abuse among youth and adults, with a focus on environmental strategies. The task force employs efforts on policy making, substance use intervention, and prevention. So to date, we have about approximately 175 members on that task force. And consistently, we have at least 35% of those members actively attending. So we have about 40 to 60 people that attend each meeting, and they're bi-monthly. Under this SUP umbrella, there are 4 very dynamic subcommittees that fall under the SUP task force. One of those is the Massachusetts Opiate Abuse Prevention Collaborative, or otherwise known as MOPSI, and members through the leadership of the City of Lowell Health Department. They lead the efforts in reducing accidental overdoses from opiates, as well as educating the community members on the dangers of substance use leading to abuse. Opiates include heroin, as well as prescription painkillers. So from 2008 to 2013, the members focused on the consequences of opiate abuse, which is overdose and possibly death. And since July of 2013, the primary opiate prevention has been incorporated to their focus. The goal of the Environmental Strategies Working Group, ESWG, is to inform and educate youth, parents, and adults in the community about how substance abuse is affecting our neighborhoods. And by doing this, they hope to create policy change and reduce the percentage of substance abuse in our community. And we have a number of youth from that group here with us this evening, so thank you. The Medical Marijuana Subcommittee focuses on the law, which recently passed allowing for the medical use of marijuana. This committee has convened local leaders to discuss the concerns around enforcement and among access, among any other issues as well. And the 4th subcommittee is the School Curriculum Subcommittee, which focuses on providing age-appropriate, evidence-based education to youth grades K through 12 in the public schools. So the SUP task force represents a diverse cross-section of 9 different communities. Some members include police, fire, local ambulance companies and boards of health, healthcare professionals, elected officials, school administration, community members, substance abuse support groups, universities, and colleges. These partnerships have led to engagement at over 2,500 residents annually. Over 50 compliance checks are conducted quarterly. Drug prevention education from the 3rd to the 12th grade students, reaching over 2,000 students annually. Also, the data collected through the ESWG, youth usage of alcohol, tobacco, marijuana, and other drugs, they've seen a steady decline over the past 4 years. I brought some data around that as well on some of those studies that they've conducted. I'd be happy to share that with you. Last year, the Greater Lowell Health Alliance partnered with Lowell General Hospital and the University of Massachusetts Lowell to conduct a community health needs assessment to identify the unmet needs around public health within the Greater Lowell community. This study identified substance abuse issues as one of the most urgent unmet needs threatening the health and quality of life in our region. Earlier this year, the state, recognizing this urgent need to find solutions to the substance abuse crisis, allocated $200,000 to the GLHA for substance abuse prevention and education. And I'd like to thank the efforts of our state legislators, and specifically our champion here, sitting next to me, in substance use and prevention, Representative Tom Golden, for that. The GLHA issued an RFP, or a request for proposal, to release the funds to individuals and organizations that will address these issues head-on with prevention and education programs. So I don't want to spend a whole lot of time on the individual grants because it's quite a lot of information, but I did bring that information with me in our annual report. But just to give you a real quick synopsis of some of the grants that we funded, $100,000 was given to a regional effort around substance use and prevention education in our schools. We're finding it's very difficult to get into the schools. The time restrictions and all that. So we're really working with the school departments regionally, not just in Lowell, but Lowell's been great coming to the table on our curriculum development piece, and really trying to figure out how can we incorporate education into the schools around this issue and make time to make this an important initiative and discuss it in schools. So we're very committed with that education process, and what they're doing is they're working with the individual towns, trying to, almost like a train the trainer, and buy the program for them, and evidence-based materials, everything, give it to the schools, and then they can go from there as far as doing the education themselves. So it should be sustainable. Some of the other funding grants were Bill Ricca Substance Abuse Prevention Committee to hire a coordinator to strengthen a comprehensive substance abuse program. Westford Health Department got some funding around utilizing evidence-based prevention programs to reduce substance abuse in Westford. Tewksbury Police Department for Substance Use and Prevention Education Week. The Mental Health Association was funded through to fund a substance abuse prevention specialist. Lowell Public Schools to do a program around arts and substance abuse prevention in the Lowell Middle Schools. Lowell House Inc. for a prevention outreach project. Lowell Police Department for their drug awareness event. Drake Public Schools for a substance awareness program. The Town of Chelmsford for a substance use disorder education prevention week. So although we're truly grateful for these funds, I can speak to some of the many efforts being done to address substance abuse problem here in Greater Lowell. This funding was spread out thin, and there's definitely a dire need for additional funding to be put in this area. I'd also like to acknowledge the work that's being done through the Middlesex District Attorney, Marion Ryan, and the efforts of they have an opiate task force as well. And one particular achievement there was the opening of the drug court here in Lowell. So I just wanted to make sure I mentioned that. So this, as you're well aware, this problem is affecting all of our communities, and I truly believe the only way that we're going to win this battle is by working together. I just want to thank you once again for your attention to this important matter, and I invite you to attend any of our task force meetings in the future. I brought those dates as well for those, if you're interested. Thank you.
Thank you very much, Carrie. You certainly covered a lot of ground there. You're doing a whole lot of good, I could tell you that, and we need you, and please keep up what you're doing. And you start with outreach to kids all the way to adults, and it's all inclusive, so to speak. So please keep up what you're doing, once again. Thank you.
Thank you.
Next, we'll go to,
I have a
oh, I'm
question.
sorry, yep, Council Mercia.
Thank you, Mr. Chairman, through you to Kerry. Kerry, thank you so much for being here. This is a very important and critical topic. It affects our whole economic development of this city. And I believe that education, not in the high school level, but in the lower elementary grades, that's why I'm so happy to see these 5 students here. This is very, very important. I firmly believe that you can take a person and teach the children, but if you don't have the youth talking to the youth, they're not going to listen to anybody else. The youth hear the youth. And when you get in the upper levels, a former drug addict that was reformed is your best client to speak to people, because they've been there and back and they reform themselves. And that, to me, they're saying, if I can do it, you can do it. So I'm very happy that this has taken place, and I know that we're going to get to you, Representative Golden. You have been so instrumental in opening up a facility detoxification center in Tewksbury that was closed, and I believe firmly, I think the critical issue is we need more of these facilities, and we're just not having them. We would rather incarcerate someone that wouldn't get the full potential of services and just lock them away and try to deal with them there and be babysitters for these people that critically need to get off drugs. Just like mental illness is another issue. We lock them up. They need to be serviced by proper doctors. They need a doctor. They don't need a jail cell, a correctional officer. They need a doctor. This is my opinion. When we talk about your program, I firmly believe in your program. You send me a notice all the time. I work for the Sheriff's Department myself. They go to the meetings. I have to stay behind, so I never get to go. So I really miss that. I would love to go, but it's at a time when I can't get out of work. We say that this is a critical level, opiate abuse, drug abuse, critical epidemic. I believe it. I've said it for a long time. It's happening too much. What I'm asking is, have we made any dent in this epidemic? Have we?
I believe, some of the data that they're working with the students, it's showing a decrease, but I was just told today that that data is going back up. So unfortunately, we'll know more information. They are doing some studies now to find out, but I hate to sound negative, but it definitely seems like it's just getting worse.
Then we need more facilities opened up. We need, I'm wondering if that person that did a drug overdose and would have died, but got that Narcan spray and became alive again, did that ever wake them up to say, I don't want to die? Do we have a statistic on that? How many are gonna,
I don't, yeah.
you know, people are going to house parties, they're going upstairs into the cabinets, and they're putting the pills in a hat and taking out their pill of choice. It's crazy. I see these people all the time. They're not bad people. They just got hooked on something, and I'm trying to get them off it. And we can do all the statistics and goals and everything else and rack our brains and get the students involved to teach other students. But if we don't have the facilities,
To take care of them.
we're shoveling the sand against the tide is what we're doing. And that's my beef. It's my frustration.
I'm hearing more, it seems like more agencies are opening up because it is such an issue. We've had someone come to our Substance Use and Prevention Task Force today, the Clean Slate program that we had never heard of before. And they're saying they have no lines, there's no waiting lists, and that was encouraging because we're hearing so many other waiting lists everywhere else. So there are, I'm going to actually be taking a tour of their facility before I speak too much about it, you know, but I'd like to learn more about what you know, what their facility is like. But
I see here as well that we have Mr. Gard, the director of the Lowell House, here in the audience. I wish that you would have sat up here because I know you do a tremendous job with people there as well. And I would have loved to hear from you as well, but maybe we'll have a second half at another time, but you're welcome in the future to be here as well. Thank you.
Thank you very much, Council. Well put, Council Mercy, and Mr. Nagad will get an opportunity to speak by the end of the hearing. But our next speaker is certainly a man that's been on the front lines in this issue when it wasn't even known to be an issue, quite frankly, and that's Representative Golden. Tom, you've done so much on this issue, and we certainly need you. As Council Mercy, to echo her comments, the reopening of Tewksbury State Hospital, that was long overdue. We need more of these facilities, and it seems to be hard locating them because, the sentiment is nobody really wants them in their backyard. But this is a regional issue. It's all of our problem, and it's something that we all need to deal with to help work together to help solve. So I want to congratulate you on a recent grant that you sought out and received for the Greater Lowell community, a couple $100,000. If you may want to elaborate to the committee and the folks at home of what's the intention of that grant money and what's that going to go to?
Well, thank you very much, Mr. Chairman, and through you to the committee. I want to say, first of all, thank you very much for you reinvigorating this and bringing this back and to the entire City Council. I do have to say that the City of Lowell, first and foremost, has been a leader on this. We've been doing this, unfortunately, for about 9 years. When people started to discuss this, people didn't think it was going to be that big of a deal. This is just a passing phase. But at that time, the predecessor to Chief Taylor, who has done such a fabulous job, Chief LaValle, Superintendent Franco, a lot has already happened here in the City of Lowell, and that's happened because of the leadership, quite frankly, right here in this building. The City Council is, of course, supporting Greater Lowell Health Alliance, supporting us down in Beacon Hill to make sure that we're trying to bring as much money back as we can. I believe that all of us know that the damages that this causes, I think it's not just to our society as a whole, it damages our economy. People aren't going to work, people aren't working to their full potential, but most importantly, I think it's damaging our families. And when the families are being damaged, that's just something that is not obviously good for a city or for a town or for a Commonwealth as a whole. As Kerry had stated earlier, when we picked this money up, it was decided to try to work, and Kerry does this with the Greater Lowell Health Alliance, to work with the entire community. This type of problem, this type of epidemic doesn't know a border, doesn't understand socioeconomics. It doesn't understand if you're from the City of Lowell or the town of Dracut or the town of Chelmsford or Billerica or so on and so forth. And I think that's what we have here in the City of Lowell. We have something that is very unique. I think the Greater Lowell Health Alliance is really stepping up and taking a huge lead to try to educate all of our children. And they've done that with the assistance of, once again, people right here in this city. We have leaders in this city. I mean, folks like Terry Downs, who's here from Middlesex Community College. He's been one of those folks that's been here from day one. I already mentioned Superintendent Franco. Her leadership with Assistant Superintendent Murphy at that time, really making it happen in our schools. That really spawned a lot throughout our towns, and this is really truly happening, and I really believe it's happening because, once again, the leadership in this building right here. You may have heard that this epidemic is real. In the beginning, people were very hesitant to talk about it. They were very hesitant to accept it. And quite frankly, I received quite a few nasty emails, to be quite honest with you. But over the years, I believe that people are becoming more accepting to this, that mental health, substance abuse is something that we need to talk about as a community to once again go back to what we spoke about earlier. It's damaging our society, our economy, but most importantly, our families. So, yes, we were fortunate enough. Tewksbury State Hospital, the detox center, did close at one time. But you know something? Through perseverance and through the support of the city, through the support of the state, and so many players that are in this city, Frank Singleton, once again, another gentleman. I can tell you that the number of times we sat down, myself and Frank and Terry and some of the folks over in his office, trying to talk about how we can do this. My message tonight is this can be done because of this community. People throughout the Commonwealth of Massachusetts are now coming up to us, coming up to myself, Representative David Nangle, Senator Eileen Donahue, saying, how are you doing it in your area? I really, truly believe we are making a difference. I really honestly believe we are making a difference. But to Councilor Mercia's point, we do need to spend more money. We do need to spend more of our resources as opposed to incarcerating people to ensuring that they get the treatment that they need. And that treatment could come from the perspective of a 30-day bed, a 30-day hold, or something that is needed on an outpatient basis, which, you have one of the experts, once again, here in this city at the Lowell House, Bill Garr, who is here tonight. We have, I believe, all of the knowledge and the brain power in this city that can truly make a difference. Greater Lowell Health Alliance, the Lowell House, Lowell Community Health Center, all of these individuals work as a great, great team, and they have worked as a great team, in my opinion. You have the political strength, I believe, in this city to make sure that this problem is taken head on. And I say political strength because just recently, I'm sure that when you had seen that Governor-elect Baker is making this a priority, a real priority. Mental health and substance abuse is something that's affecting each and every one of us. We know a family member, a friend, a neighbor, something's gone wrong, and it's the only true way that, quite frankly, the chief and all of his fine officers here in the city, boy, they probably wouldn't be as busy. They probably wouldn't be as busy if we were really tackling this problem the way we should be. And I have a lot of hope that we will be tackling this problem because of what the comments have been made, but most importantly because of the courage that this city council has shown. Quite frankly, this city has shown. This city has shown that this issue is not an issue that ends at our borders. It goes throughout our community, it goes throughout our Commonwealth, and unfortunately it goes throughout this country. And it's something that I really feel strongly about. I feel that we have been at the forefront, and we will continue to do a good job at this. So, to the city councilors, Mr. Chairman, to all of you, I am here to listen. Councilor Mercia, I'm reading you loud and clear. We were already talking, and I have to say, once again, to Terry Downs again, we've been talking about how we can actively do this. These are papers that are going into the governor's office to find out how we can possibly make some more availability to help these folks. Because, folks, whether you agree with this or not, these individuals, once the chief and the men and women of the Lowell Police Department do their job, and these folks are put away, they're coming back to our community. If we do not treat them, the recidivism on this is just going to continue and continue and continue. And I believe it's our job to make sure that doesn't happen. And I feel more confident today, very confident today, that, once again, the political strength is there, the will of the people. People are talking about it. This is not an issue that people hide from any longer. This is not an issue. Everybody has an opinion, and I have to say that I believe that that opinion has changed dramatically over the past, what I would say, the last 9 years, where people are now becoming firm. People need to pay their debt to society, but yet sympathetic to make sure that these individuals can get back to their family and to get back to a productive life. So once again, Mr. Chairman, thank you very much for everything that you're doing. Thank you very much to all of your colleagues. Every single one of the city council have been supporters, has talked about it, and I really believe we have a winning team with the Lowell House, Lowell Community Health Center, our own City of Lowell Health Department, and the Greater Lowell Health Alliance. I think we have a winning team. I think we can do it, and I think we have the will to do it. And I'm here to listen and to try to work collaboratively with everyone here. So thank you.
Thank you very much, Representative Golden. You've done more than listen over the years, okay? You have done an outstanding job on this issue, and that political strength you're referring to on this issue is you. You are our leader on this, Representative Golden, and we will follow your lead from here on. And thank you very much. Councilor Rourke, then Councilor Mercia.
Thank you, Mr. Chairman. The one thing that the chief and Councilor Mercer and I all have in common is that this is a problem that we deal with every day as far as our employment is. And just to give an example of what the state rep has stated, that a few years ago, Lowell did a study with all criminal cases that came into the courthouse. And mind you that it's not just the city of Lowell that district court deals with. And again, Councilor Mercer, I know, can speak to this. It deals with Chelmsford, Tingsboro, Drake, Tewksbury, and Lowell. Once you take away the minor motor vehicle offenses, such as operating without a license or registration, over 85% of the crimes that come into the courthouse deal with drugs and alcohol. And more so in the last 3 or 4 years, over 50% of those crimes is opiate abuse. Your larcenies, your domestic assaults, your regular assault and batteries, it all deals with drugs, alcohol, and more to the point now of opiates. We see it being dealt, we see it being sold at a very cheap price nowadays, and it's very difficult. It's, as we talked about before, it's an uphill swing upstream. It's a terrible situation, but the one thing I want to recognize is the work that's being done. They start off with the chief, they come to over us at the courthouse, and then they go to Councilor Mercer's place to work with the sheriff's department. And these people are getting constant help, they're getting constant addiction services for their problem. And it's true, the nasty emails, Representative Golden, that you get years ago, I doubt you get those now because every family has this problem within their family. It's the only analogy I'll make is many families deal with somebody in your family has probably dealt with cancer in the past, a terrible disease. Everybody in someone's family deals with addictions. It's just whether it's drugs or alcohol, it's there. To throw them in jail, is not the right answer. To Councilor Mercer's point, more services, more rehabs, more detoxification centers is the answer. So, Representative Gold, my question to you would be: right now is Tewksbury at full capacity as far as beds goes?
No, it's not. It's something that, with the detox center originally, when it did close, it closed for a reason that the per bed, the dollar figure that was being given back by the state, and this is on the state, wasn't sufficient to keep it open. Fortunately enough, through some budget appropriations, and I believe it was closed for the better part of a year and a half, almost going on 2 years. And Leahy Behavioral Health Services finally bid in to reopen it. But with some additional funds that we had put in, we were able to rehab the unit, open it back up, and Leahy had a real opportunity to make a go of it. And Leahy Behavioral Health has been doing a great job out there. I've met with those folks probably a dozen or so times, and I'd ask them again, is it something that they feel as though that they could do more of? And the unfortunate answer is yes. They feel as though they could do more. So my job, our job as a community is going to be trying to see if there's any type of expansion possibilities. I mean, it's a vast hospital out there, and there's a lot of possibilities out there that we could increase. But sometimes the 30 days isn't necessarily always the answer. It could be the outpatient stuff, and that's something that I believe Bill Garr from the Lowell House would have a real handle on as to how to tackle this. But this is something that is actively being worked on. tip of the cap there goes to everybody out in Tewksbury for making that happen, Tewksbury Hospital. And I mentioned them already, but Terry's out there on the board. But that's why they're there. They're there to help. They're here to make sure that these problems are absorbed. These folks are coming out and a lot better than when they went in after the detox. And sometimes I'm hearing it's the detox portion is okay. It's the next portion. It's that 30 days that someone may need. You know, kicking addiction, and I'm not an expert or anything close to it, but I talk to a lot of these folks. This is something that is extremely, extremely difficult. If anybody listening out there today has ever tried to, this is how it was explained to me. If you tried to ever quit smoking, if you ever smoked in your life and you tried to quit,
Right.
and how many times did you try to quit? Well, I'm very happy that I don't know this, but apparently it's 100 times harder to quit some of this stuff that these people have been doing. So if you've tried to quit smoking and failed at it, maybe you can have a little bit of empathy as to, you know, how difficult it is to try to get, you know, hey, these are our brothers, our sisters, our cousins, our uncles, our aunts, you know, family members, neighbors, to try to get them on the right track and try to get them back into a productive life. So,
And one quick question, maybe the chief can answer this as well. You spoke of overdoses on the street that have been revived through Narcan. And maybe the representative knows this answer. Is there a process that goes after, you know, you have someone on the street that's out and the Narcan brings it back? Is there a forced process or a law that's in place that makes them go to a hospital and makes them,
No.
you know, 72-hour hold, nothing at all?
It's currently a void in the system. The only way that we can take somebody into protective custody currently in the Commonwealth is for alcohol. So I think there's a legislative fix in for this session, and I hopefully would anticipate that they'll correct that. Because what happens is the Narcan only lasts for about 90 minutes, I believe it is. And actually, we had a situation last weekend where somebody overdosed twice within a few hours, and they had to be revived twice. And it's exactly on point to what you're talking about. So we need a legal mechanism that once they're revived and once they, you know, get emergency medical treatment in the field, that we can force them by a legal means to go to an emergency room and receive follow-up treatment.
That's right.
You know, most times in place, you know, it becomes a 72-hour hold for alcohol. I know that when someone goes to an emergency room or to a hospital, you know, a section 12 is what it's called, usually is a 72-hour hold. So right now, I understand that it's just for alcohol, but maybe, you know, Representative, if we could, you know, amend that to include, you know, for drug addiction as well, I think it's a great idea.
Council, no question about the Section 12 would be something that we should be looking at. But, you know, for as long as the city of Lowell's been doing this, this is still really starting to become something that people are accepting. And, you know, Narcan is something that was only used occasionally. I'm not the expert on this, but I know that through the city council's wishes, and I know that the Lowell Fire Department has put it on. I know that the police department is doing it. And what you're seeing now is a lot more people are being saved. And what happens during this Narcan, if somebody is going through an overdose, Narcan apparently wakes them up immediately. And sometimes I understand these folks aren't too happy with being taken out of their euphoric state. So there's a lot of anger, you know, and these officers and firefighters and EMTs, they're putting themselves in a lot of danger at this point in time. I think the Section 12 is something that can be done. I think it's a great idea. But once again, we're still learning on how to, there's another problem that's coming up. How do we fix it? Well, we need to fix that Section 12 because of the 72 hours currently right now with alcohol only. So that's a great point and a great idea.
Very good. Excellent questions, Councilor Rook. Councilor Mercia.
Yes, thank you very much, Mr. Chairman. To you, Tom Golden, I want to thank you very much for all that you have done in this particular issue. I know that your wife is a pharmacist, so you kind of stopped that issue where someone was having a prescription and go in this place, and then a little later on go into another pharmacist and another, and you stopped that because they were just really trying to get all these pills to either sell or use themselves. So that's a very important issue, and you really calmed that down. But I'm getting back to the fact that we just put people in prison when they probably shouldn't be, and we need that safety net there called a detoxification center. I really believe that. And the reason I'm so adamant in my beliefs is because when you see clients every day coming in, and they're being serviced by our program. And let me tell you, there are a few that come back and say, thank you, you saved my life. So I know that the Sheriff's Department is truly working. When people come back to us and say, I never had anybody care for me in my life, but coming here, the people here cared for me. They made me feel like I was important, that I didn't want to hold myself down to be on drugs. So that's a good thing right there. But when we have others that say, I'm slipping again, I'm slipping, I need to get that extra help, I need a bed, and we have our clinicians call and there are no beds. That is disturbing to me when someone is crying out for help and we don't have the availability for a bed for them. That is mind-boggling to me when they're asking for help. And so what do? They go off, they do drugs, and they commit a crime, and they go to jail. There's a bed in jail, but it's not the right bed. So these are the things that I'm saying. We have to work together and demand some money to create more facilities. We'll truly do. There's not enough beds out there. I know firsthand, and I know that people come in and people are pretty decent, and I try to be decent to them because I know a lot of them turn this way because they had nobody that cared. So I try to be a part of the place that we care. And they turn around and they become nice, but there was a time when someone came in and became very agitated and mean and went away for a few days and come back and apologized to me profusely, saying I was off my medication and became normal right again. That's what we need. We need mental health facilities, so someone oversees their dosages that they have to be on. And we're not all, many people are at varying degrees. If we're functioning properly, that's good, but there's a lot that aren't, and we have to be careful and care for them. And that's what I'm...
Well, one of the successes this year in the legislature was the Substance Abuse Recovery Act, recovery legislation that was passed. It deals with drug formulation and abuse deterrent and everything else, but one other piece that it does deal with, and it does talk about requiring that all insurance carriers to reimburse for substance abuse services. Now, once again, this is something that is new. This is just going through now, removes prior authorization, so all insurances have to have it. What we're finding out is that we don't have the capacity yet to actually meet all of the demand. Once again, I still think it goes back to the point that people didn't believe that this was going to happen. This, what I would say, is a tsunami, and it is still happening. So I think that the health field is catching up, and it's something that legislatively we're trying to encourage. And my hope is that is coming. That is coming. Once again, not having a detox facility in this area a couple of years back was just 100% unacceptable. And we as a community changed that.
Yes, you did.
This community changed that. And Councilor Mercia, what you're saying about having those beds available, I really believe we as a community will change this.
Well,
I do.
I hope so. And I will say one thing, I'm sorry, I don't want to monopolize this, but I know what it is to be a drug addict. Not that I was on drugs, but I was on a cigarette. I was a smoker for I don't know how many, maybe 40-something years. And one day I made a bet with my son. I said, if you stop drinking, because you can't afford to go to jail yourself, I'm not proud of that, but I said, if you stop your drinking because it makes you crazy. Some people drink and they become nice people. They want to eat, they want to have fun, they want to be funny. Well, not some people, not everybody. Some people are very mean. And I made a bet with him. I said, if you stop drinking, I'll stop smoking. Thank God there was a patch that helped me to stop. And October 25th was 10 years. He didn't have a drink in 10 years, and I haven't had a cigarette. But it isn't that easy for some people. But I want them to have the opportunity that I did. That's why I supported the methadone clinic. They need to get off the drugs somehow. And if that will help them, then that's a good thing.
Thank you. Thank you, Councilor Mercer. It was well said. I'd like to go to former Mayor and Councilor Bud Caulfield, who was the last standing member on this subcommittee. Councilor, you may take the floor. We have just a few minutes. I would like to have one more speaker in the audience, so thank you.
Thank you for the time. First of all, I furnished the subcommittee with information I received off the internet, Also, what part of that information is I went over to the school department. They have a curriculum in the school department as well on substance abuse. And I want to thank Mayor Elliott for resurrecting this subcommittee that's been long, long overdue. And I want to applaud State Representative Tom Golden. He has been a voice in the desert crying for help.
I agree.
And it's long, long, long overdue. And the perils of drugs. And I want to thank these councilors for serving on this subcommittee. It's extremely, extremely important. In the state of Massachusetts, 2 people die every day because of an overdose of drugs. In the United States, 100 people die every day because of an overdose of drugs. That is 36,500 people a year. And this problem is right before our eyes. And we all kind of brush it aside and say, it will go away. Someone else will take care of it. It's not going to happen. This is how it's going to happen. Working with elected officials throughout the entire region. And Mr. Chairman, I would like to see the subcommittee have meetings, not here in the council chambers, but have a meeting with elected officials in Barica, Tingsboro, Tewksbury, Westford, and so forth, and bring everyone together because they all have the same problem. And they're probably waiting for someone to knock on their door to make that meeting happen. So that's a suggestion that I have. Because when I was the chairman of this subcommittee years ago, we did not have meetings here. We went into every single neighborhood. Every neighborhood. And I can remember planning a meeting at St. Patrick's Church. And Father Conway called me, he said, Counselor, I received a call, if this meeting continues tonight, there'll be a flat tire in every car in the parking lot. I said, tell them to come on. You just can't let them scare you. You just have to do what you think is right. I have some statistics here that are extremely alarming. In 2013, the incarceration rate of the United States of America was the highest in the world, at 716 per 100,000 of the national population, while the United States represents about 5% of the world population. It houses around 25% of the world's prisoners. There are 2.3 million prisoners costing $24,000 a year. Do the math on that. How many bridges and roads could we rebuild? Billions and billions of dollars is expended on people who are on drugs. And I agree with Councilor Mercia. Drug addicts don't belong in jail. Drug dealers do. And I'm sick and tired of lawyers going to the courtroom having a plea bargain for their client. I was amazed when the Lowell police, and they're doing their job, the Lowell police arrested a man on West 6th Street. Chief, how much did he have? A kilo of cocaine in the car? Kilo of cocaine in the car. $87,000 under the front seat of the car. And what this subcommittee should do is follow up. What happened to this person in the courts? What did the judge do? How did they sentence him? 85% of inmates convicted of burglaries are the highest rate of substance dependence and abuse. 75% of inmates in jail are there because of drugs. 75% of their crimes are because of drugs. It's a horrendous disease, not for the drug dealers, The drug dealers are making a profit on this. They don't take vacations. They work 7 days a week. They receive the call, and they're there. And they're poisoning the youth and the young people in this country. An estimated 12.8 million Americans, about 6% of the household population aged 12 and older, use illegal drugs on a current basis within the past 30 days. This number of past month drug users has declined by almost 50%. But if you turn the page, the most alarming trend is the increasing use of illegal drugs, tobacco, and alcohol amongst youth. If you read the obituaries in any paper, the ages of 20 to 40 died unexpectedly. Died unexpectedly. And who are they hurting? They're hurting the family members, society in general, and just the well-being, The social and health costs of society of illicit drugs use are staggering. Drug-related illnesses, death, and crime cost the nation approximately $67 billion a year. Every man, woman, and child in America pays nearly $1,000 annually to cover the expense of unnecessary health care, extra law enforcement, auto accidents, crime, lost productivity resulting from substance abuse, illicit drugs use hurts families, businesses, neighborhoods, impedes education, and chokes criminal justice, health, and social service systems. I know your time is running kind of slow, and I just have this one thing to say. Drug trafficking generates violent crimes. Trafficking in illicit drugs is often associated with violent crime. Reasons for this relationship include compensation for drug markets and customers. How do you stop it? Well, the war on crime goes way back, God rest his soul, to President Ford. You know, the war on crime, unsuccessful. Because the people in this country, if the neighborhood ice cream man was delivering ice cream, and the ice cream had a chemical in the ice cream that could severely injure a child, everyone in that neighborhood raised up in arms. But it seems that the drug issue is let someone else worry about it. Well, Mr. Chairman, Councilor Rourke, Councilor Mercier, and this wonderful cast, it's time we all step to the plate. It's time. And the next meeting, Mr. Chairman, call the selectmen, call the councilors. This subcommittee, this council, this mayor, this administration could be the role model in the state, to bring this to a head. Bring it right to Beacon Hill and say we have to do something. Talk is cheap. The cost of drugs isn't. Thank you for inviting me, and I wish you much success.
Thank you very much, Council. There are strength in numbers, and I assure you that's exactly that would be my intent to reach out. Thank you to all the guest speakers, and I'm sorry, Mr. Garr, Mr. Downs, Mr. Singleton. I was hoping to get some input from you this evening, but next meeting, and especially to you, and there will be a part two. And to you boys and girls, thank you very much. I wanted to hear from you this evening. I want you to know we care about you, and promise me you'll be at the next meeting to speak. Okay? Thank you very much to everybody. Motion to adjourn.
Second.
Meeting adjourned. What's going on?